Well, welcome to the Health Matters podcast. Mental health continues to be an important focus area for Wellmark and the employers and members we serve. In 2024, I was fortunate to have Cammie Jenkins, Vice President of Health Services, and Dr. Matt Stanley, Senior Medical Director for Behavioral Health, join us and talk about mental health solutions and resources available to members. Since then, Wellmark has continued to expand our efforts, and today I've asked Donna Rackley, Director of Health Services Case Management, to give us an update. Donna, welcome. And
thank you for having me.
Yeah, I'm glad you're here. If you wouldn't mind, please give the audience a little bit about yourself and some of your background.
Certainly. I am a nurse by education. I have been a case manager for many years. I arrived at Wellmark in June of 2022, and it's been a great experience for me to be aligned with case management here.
Yeah, it's been great to work with you. We've had a few things over the past year. So, last time when we had a conversation about mental health on the podcast, as I mentioned, Cammie and Dr. Stanley were with us, and we were talking about some enhancements that Wellmark was actually launching last May. And you are leading that team, which is part of that enhancement. If you wouldn't mind giving us an update on that behavioral health team and some of the things that we're doing today.
Certainly. I think before I start, I'd like to kind of level set around case management and
that
what
would be
that
great.
is.
Yeah, that does confuse people sometimes. What does that mean, and how does that fit in with all the services that are offered to our members?
Exactly. So case management's available to all of our members. We're there to support members as they have their health journey. We use claims and other data to identify members that might have gaps in care or have other chronic health conditions that we could help. We also get referrals from, it could be from customer service, it could be from your provider, it could be from your account manager, or your HR team could make that referral on your behalf. And then once we receive it, we'll case manager from our team. That could be a social worker or a registered nurse that is aligned with the program. Will outreach to that member and do an assessment to understand what their care needs are, and then work with them to develop an individualized care plan. And that'll begin their journey together to help support their healthcare needs. So that's kind of high level what our case management program entails.
Yeah, thanks for sharing that. So when we talk about the behavioral health team that you lead, how's that different than case management that's offered?
So our general case management's focused more on medical conditions, and we saw an increasing need and more individuals that just needed that behavioral health, mental health support. And we decided to stand up the case management program, as you referenced, in 2024. So we've expanded that team. We now have 10 behavioral health social workers and registered nurses. They all have an extensive experience and background in behavioral health, anything from children, adolescents, through adults and seniors, and they're there to support that team. Additionally, we added a behavioral health team leader that's focused on leading that team, and a medical director, Dr. Stanley, that you have interviewed previously on the podcast.
Yep. So the intention of the team, if you want to talk about like what is the intention, what is the hoped outcomes for them?
So the outcomes, we want to help that member understand their condition, be able to collaborate with them on a plan of care, and that plan is highly individualized. So whatever condition that member is working on or focused on, it could be a mood disorder, it could be anxiety, it could be depression, eating disorder, it could be substance use disorder, the whole gamut of conditions. We will support that member. We'll help them find providers. We'll additionally help them navigate the system as far as right level of care, right kind of provider. We'll support them with that plan of care, understanding their medications and adhering to them, helping them understand what that plan of care is that their provider has worked with them on, making sure they understand the plan of care and know how to implement it within their lives to help have better outcomes.
Awesome. So there's been some expansion on the team this year too, as far as the services they cover. Is that, am I saying that correctly?
You certainly are. So, our transition of care program, we expanded that. We have included mood disorders and substance use disorders. We originally started with 15 codes that we would look to identify members, and we've expanded that to 618 codes. So, a broad expansion of who we identify and who we reach out to help support those members.
That's great. That's fantastic. I don't think I was aware of it being expanded that much. So, that does touch upon a question we do get from employers and, what benefits, we've mentioned that that's part of the benefit they get, but what benefits are included with the administrative services that they're purchasing and what are considered buy-up options?
Certainly. So everything I've talked about so far, that's all included in your core benefits. So that would be built into your benefit package. In addition to that, you have your medical benefits, and that's where your PCP comes into play. And that is a great resource for understanding where you could go from a specialty perspective. So if you were looking for a therapist or a psychiatrist or someone to support your behavioral health needs, that PCP already knows your history. He knows what's going on with you and your care. That's a great place to start.
Yep, totally agree.
Yeah, and then I think if we want to talk about, buy-up point solution type things, we offer a wide array of those additions that an employer group could elect to cover. So one of those is Mequilibrium, and that's a stress coaching product. It also has a component of focusing on healthy work-life balance, which is important to all of us, right? Another one that we offer.
I'll tell you, I utilize Mequilibrium, and I get those little sayings every day, kind of help you deal with stress. It's helpful.
It is. It's a great product. So great to hear that you use that. The other one is Doctor on Demand. So we have Doctor on Demand. Access Anywhere kind of is the theme there, but this Doctor on Demand with the behavioral health, it adds that one-on-one behavioral health coaching as part of that. I think the beauty of that is the anywhere access, right? Because we have a lot of rural communities, and if you want to tap into that availability anywhere, that's a great option for that. Another one that we have is WebMD. So if you think about that one, it's stress specialist coaching that can help you with stress levels. So we have some great options from a point solution perspective or buy-ups that employers can add.
Yeah, you talked about ID and stratification earlier, and how we proactively can reach out to members. For employers wanting to direct their members, and you've mentioned, there's many ways they can do that on how to find mental health support. What are things that they can do? What are the steps that members can do outside of some of the things you mentioned already?
That's a great question. I think, like I talked about earlier, they can start with their PCP. They know you and they can help direct you. Additionally, they can reach out to our customer service team. They're able to direct you to providers or to resources that's available. From a digital perspective, we have my Wellmark, and I would encourage anyone that hasn't to enroll in that. I find that very helpful. But Provider Finder is there. It allows you to look for specialists that are contracted with Wellmark that you would be able to see. Additionally, we have an anxiety and depression screening tool on my Wellmark, so members can self-screen for anxiety and depression. It'll give them information about that, and then it also offers the ability to self-refer into case management. As part of that, we have a behavioral health landing page that's included within my Wellmark, and there is a wide variety of information that can help support an individual. The other opportunity there is just your account team. They're there to support you. Anything you need, you can reach out to them, and they can also make a referral into case management on that member's behalf.
And I know we do that. It's just about every other day, it seems like. We've talked previously about related to case management, or we've talked previously about case management and behavioral health. case management. And, when you think about a member that's going through that, how long do they participate? When do they graduate from it? If I want to think of it that way in simpler terms, from an employer perspective, how long are they in that program?
I would say the duration, it varies greatly because it's very member-centric, depending on what kind of conditions, what kind of goals that member chooses to work on in collaboration with their case manager. It could be days, it could be weeks, it could be months. It just depends on what their goals are and what that plan of care is for that member.
So we talked about the member going through the program. What happens when they do complete it? Is there anything additional for them? What would you expect for that member?
I would expect this program to assist that member with decreasing their need for medical services. It also helps to avoid duplication of services because you're getting the right service at the right time. Decrease of emergency room visits. It also increases your utilization of your primary care provider and those preventative care visits to help improve your health overall. I think
so really all those things are a great benefit to the employer as well, to the health of the plan.
Definitely. It helps the member because they're feeling better. They have a better health outcome. And for the provider, from their perspective, decrease in cost and utilization, which is always helpful. A healthier population means lower costs.
Yep, definitely. Well, I very much appreciate you joining me today. Unfortunately, we're out of time. Before we head out, is there anything additional you want to add or any other words of note you would like to say?
Just thank you for the opportunity to share more about the enhancements and the updates we've made. I'm a champion for this program and really glad to be here and share the updates.
Thank you very much again. And thank you all for tuning in to the Health Matters podcast. We hope you found the information valuable and insightful. And if you enjoyed today's discussion, don't forget to subscribe to Wellmark's YouTube channel for more great content. And we'll see you next time.